Well, RadNet has a number of musculoskeletal imaging modalities that we use. The most common one are regular x-rays, and they tell us a lot of information about cortical bone and about general information about joint spaces. They're easy to do, they're fast, and they're relatively inexpensive. The problem is that it doesn't give us a lot of detailed information about what causes people's pain or disabilities, and therefore we commonly have to go to a more advanced imaging technology to answer the real clinical questions. And the next most important one really is magnetic resonance imaging. This has been around since the late 1980s. And magnetic resonance imaging has some decided advantages over regular x-rays. One is it's really a three-dimensional technique, so we can actually see details. Regular x-rays are just a projection onto a screen, and so a lot of anatomy overlaps, and you really don't have detailed evaluation of the insides of the body. With MR, it's really a 3D evaluation of the inside of the body. Also, MR has much better contrast for soft tissue pathology as well as bone. So in addition just to seeing the cortical bone like X-ray technologies give us, MR allows us to better visualize the inside of the bone, the medullary space of the bone. And it turns out about 50% of acute injuries to the knee, the pain is caused by injury to the inside of the bone, which we call trabecular bone injuries. And we didn't even know these existed back in the X-ray days because you can't detect it by regular X-rays or CT. So we now realize that half of the cause of pain after sports injuries we never knew existed before MR came along. Another technique that's used is CT. Computed tomography uses X-rays like plain X-rays, but it uses a 3D technique. By acquiring images from a tube that circulates around the body, we can actually do 3D imaging of the inside of the body with CT. So we get much better spatial resolution than with plain radiography. But we still have the limitations is that it does not pick up the inside of the bone problems very well and does not evaluate the soft tissues. So the bulk of the acute trauma-related injuries to the musculoskeletal system cannot be well evaluated with CT. The only exception are being cortical fractures. The next technique that's used is ultrasound. There are many, many papers touting the value of ultrasound. We've tried ultrasound repeatedly in Southern California in our sports medicine population that we deal with. And we've always found that ultrasound can detect a lot of injuries, but it can't detect all the injuries around a joint like MR can. So almost always after there's an acute injury, even if ultrasound detects an injury, we end up having to go to MR before deciding on surgery. So repeatedly now, in 3 areas in the past where we've really tried to introduce ultrasound, we found that the people still have to have MRI to have a full evaluation of the joints. And so ultrasound ended up being an add-on study that had very little value. So though in academic circles people like to push ultrasound, we've really found that it hasn't really added much value. And if you actually look at the last Olympics, turned out 60% of all imaging at the Olympics were MRIs because that's where the information is. The bulk of the rest were ultrasound and X-rays, but most people with severe injuries ended up having to go to an MR. So we typically do MR much more commonly than ultrasounds in our practice. Bone scanning and PET scanning can be used. They're primarily in this day and age for evaluating of tumors and metastatic disease, which is important but not really part of sports medicine. In the old days we used to use bone scanning to evaluate for occult fractures, but MR is much more sensitive and more accurate than bone scanning, so we pretty much no longer use bone scanning for looking for occult injuries.